My name is Irene Toldo. I'm a child neurologist. Our paper in the February 2019 issue of Developmental Medicine Child Neurology is a retrospective and prospective cohort study of a population of children and adolescents affected by tuberous sclerosis complex. The study was conducted at the Paediatric Neurology Unit of the Department of Women's and Child's Health of Padua in Italy. What's already known about this topic is that neuropsychiatric disorders are frequent and represent the main problem impacting the quality of life of TSC patients. The Neuropsychiatric panel of the 2012 International TSC Consensus Conference decided to coin the term TAND, that stands for Tuberous Sclerosis Complex Associated Neuropsychiatric Disorders. This is an umbrella term for a wide range of behavioral, psychiatric, intellectual, academic, neuropsychological, and psychosocial manifestations seen in TSC. A TAND checklist is a new tool which consists in a semi-structured interview that has been developed to screen TAND annually. Nevertheless, studies focused on TAND are quite limited. The present study aimed to investigate the psychopathological and neuropsychiatric aspects associated to TSC in a pediatric cohort of 32 TSC patients with a mean age of about 9 years. What's new in our article is that we prospectively evaluated TAND with an integrated use of different tools. We used a self-administered questionnaire, the Child Behavioral Checklist, that is widely used in clinical practice to screen emotional and behavioral disorders. We also conducted semi-structured interviews with two tools. The first is represented by the authorized Italian version of the TAND checklist, requiring about 15 to 20 minutes. The second by the Vineland Adaptive Behavioral Scales, requiring about 45 minutes. TAND checklist reveal at least one TAND in 80% of our subjects and more than 4 TAND in 78% of cases. In order to compare the results of TAND checklist and that of CBCL, the items of TAND checklist, which refers to behavioral level, were grouped in 3 scales following the CBCL model: internalizing, externalizing, and total problems. Our results show that TAND checklist was more effective than CBCL in detecting neuropsychiatric and psychopathological problems associated to TSC, in particular for externalizing and total problems, while internalizing problems were more frequently identified by CBCL. This data could be explained by the different construct and methods of administration of the two tools. Overall, our sample was phenotypically very heterogeneous. The TAND most frequently found in our sample were attention difficulties, language impairment, intellectual disability, and school difficulties, but it was not possible to identify in our TSC patients a unique and constant neuropsychiatric profile. Moreover, we looked for possible correlations between the neurological phenotype and psychopathology. We found that TAND prevailed in subjects with severe neurological and epilepsy phenotype. In fact, intellectual disability, high frequency of seizures, and drug-resistant epilepsy are known risk factors for the development of behavioral disease. Conversely, mood disorders, revealed in our population by TAND checklist and not by CBCL, were reported only by subjects with normal IQ. Our paper adds to the pertinent literature that TAND checklist is an effective tool for TAND screening. TAND checklist helps define psychopathological and neuropsychiatric aspects in pediatric patients with TSC. TAND were found in 88% of our TSC patients and 78% of them had more than 4 TAND. TAND distribution depends on different clinical and neuroradiological features. Neuropsychiatric disorders represent one of the major problems impacting the quality of life of TS subjects and their caregivers. Therefore, an accurate screening is necessary for early diagnosis, prevention, and rehabilitation. Thank you for your attention.